All right, so if you remember from notes on Wednesday, we were talking about the skeletal deformities of the foot. Today, we are going to focus on further injuries of the foot and ankle. Right now, we're going to talk about the different pathologies of the foot, skeletal wise. And if you forget, skeletal obviously is bones, and then pathologies are the conditions that can affect the bones. All right, so fractures. Fractures are going to be probably one of the most common skeletal conditions affecting the foot when it comes to sports injuries, and they can occur in any bone in the foot. So it can be big bones like your calcaneus, your tibia, your fibula, but it can even be the bones, the distal phalanx of your toes. And some fractures are going to be more typical than others, especially in sports, just because of how some sports are played. But when it comes to fractures, a lot of the signs and symptoms are going to have the same general signs and symptoms. So when somebody has a fracture, they're going to have deformities. Sometimes it's obvious where the bone might actually be sticking out of the skin, which would be an open fracture. Or it could be maybe not as obvious, but maybe it looks like something is a little bit more swollen than the others. Typically, with a fracture as well, they're going to have a limited range of motion. So you might ask them, "Can you wiggle your toes for me?" If you're thinking it's maybe their toes and they can't do that. They're going to have that crepitus sensation. So crepitus is that crunchy sound that you might hear, and that could be the actual bones, like if they're broken, the pieces kind of grinding over each other. They might have very specific pain, which would be localized. So you might ask them, "Where is your pain?" And they point at one specific spot, or it could be that it's radiating to where, it could be one spot you can see the deformity, but they're having pain all over. And then there's going to typically be a lot of swelling. So when you break a bone, you have blood vessels inside of that bone. There is a lot of vasculature in your bone. And so when you are to break your bone or fracture it, it causes a lot of bleeding. So there's going to be a lot of swelling. And typically, somebody, when they have a fracture in their foot, they're going to have difficulty bearing weight. So they're going to have, hard time standing on their leg. They might be limping. They might try to stand up and then maybe fall back down. So all of those things are going to indicate, okay, this is something maybe more serious going on. Common ones on the lateral side of your foot are going to be called a Jones or a base of fifth fracture. So we're going to get into ankle sprains probably within the next set of slides. However, you have what is called a Jones fracture and you have a base of the fifth metatarsal fracture. They're essentially the same bone that is affected. It's just one is going to have a tip of the bone that is fractured versus the other one is going to be a fracture with part of this actual muscle torn off. So if you remember what an avulsion is when the tissue is actually torn away from the body. So sometimes when you sprain your ankle laterally, so you roll it in inversion, you can actually cause this muscle to be so overstretched. So this muscle's on the lateral side of your leg, on your fibula. It can be so overstretched that it actually pulls the base of the fifth metatarsal, that bony part, with it. So you have a fracture and then the tendon itself is not attached anymore. So I think there's an image on the next slide. Okay, so your Jones fracture is going to be where this part of the bone is actually broken versus, so you'll see right here, base of the fifth is going to be that very tip. So if you can imagine, this is an x-ray, so you can't see the soft tissue. But with the Jones fracture, just the bone is broken right there. Whereas with the base of the fifth fracture, you will have the peroneal tendon is attached, let's say, to this point. It's actually taken that part of the bone with it. You can also have metatarsal stress fractures. So these are known as March fractures. And the reason why they were called March fractures is because when soldiers, I guess, were at war, they obviously were marching, stomping their feet really hard. And that's how some of them were actually breaking their metatarsals. Obviously, it's not as common anymore, but just know that if you were to, let's say, play a sport, slam your foot hard enough, you can actually break those bones. And so this is essentially a stress fracture, and it typically happens toes 2 through 4, but oftentimes it's more these two, and that's just because that's where you tend to bear weight. And then pain is going to be very localized. I don't know if you guys can hear the gardener next door, but if you can, I apologize. But pain is going to be very localized. So it's going to be specific in one spot. They're going to have a dull ache. So if we go back to what we talked about, types of pain that you might have, dull pain can indicate that there is a fracture. And then it's going to worsen with activity. So obviously, when you break something, knock on wood, I have never broken a bone. I've had stitches plenty of times, but I've never broken anything. Yeah, if you break a bone, I'm sure the more times you actually try to do stuff with it, it's going to be more painful. And so if you look at these x-rays, you will see where the arrows are pointed. That's where the actual fracture is. So this is not a Jones or base of fifth fracture because the base is over here. This is just more along the metatarsal shaft. You can also develop what is called a Lisfranc injury. So this is an injury that is due to a rotation of your metatarsals where they meet your tarsal bones. So basically where these tarsals are connecting with your cuboid, your cuneiforms, and your navicular, for whatever reason, you basically displace them. And so this is typically a very traumatic injury. So it requires a lot of force. So it's not as common as some of the other injuries, but basically how somebody were to basically injure this is they're in a very forced hyperplantar flexion. So if you can imagine, you're pointing your foot down as far as you can, or maybe you're running and your foot gets caught. And so your foot is getting overstretched in that plantar flexion, and then the toe gets then extended. And so again, this is not as common, but it definitely can happen. Sports like football, this would be more common probably than other sports. And then this type of injury definitely requires surgery. All right, our soft tissue pathologies of the foot. So we have sprains, and we've talked about this briefly when we covered, I believe, the muscular system and skeletal system last year in medical careers, but they can occur in any ligament in the foot. And just remember, sprains are specific to ligaments, whereas your strains are going to be specific to muscles and tendons. So with the sprain, the signs and symptoms, they're typically going to have limited range of motion. They're going to have, again, that specific pain. So it's going to be specific to one spot. You're going to probably ask them, can you point to the spot that hurts the most? And they should be able to do that. They're going to have a lot of swelling and edema, especially in the foot. Gravity pushes all of your fluids down. And so any swelling that's going to be there is basically going to pool. It's going to have a hard time basically getting back into your lymphatic system. And then they're also going to have inability to bear weight. And then this says positive special test for that ligament. So we're going to go over the special test after we cover the injuries, but just know a positive for a special test means that they probably have that injury versus a negative means that they don't. You can also sprain the arches of your foot. So depending on the area, you can sprain the arch. So if you remember, you have an arch right here, which is your metatarsal arch. You then have your transverse arch. You have your lateral longitudinal arch and your medial longitudinal arch. So people can sprain this major arch in their foot, and it can cause their foot to actually flatten. So before this injury, maybe they had an arch, and then once they sprain it, they now no longer have those ligaments to hold it in place, and so it might actually flatten their foot. And so this can be something where it's acute, so it just happened, or it could be something that's happened over a period of time. Oftentimes women, once you give birth to, or once you get pregnant and give birth, it's common for females to actually maybe go up a shoe size. And part of that has to do with the fact that you're carrying more weight. And so when you are pregnant and standing, that more weight is basically going to put stress on those ligaments and essentially kind of sprain them because they're going to be overstretched. And that can cause you to actually lose part of your arch as well. But that's not related to sports. Plantar fasciitis is a very, very common condition that I deal with in athletic training. So just remember, plantar means the bottom portion of your foot. And then fasciitis, you have fascia, which is this connective tissue. Itis means inflammation. So essentially, the bottom connective tissue or fascia is inflamed. So this is something that I typically see in people who do a lot of repetitive injury or motion, so like running. So cross country runners can have this a lot. Track runners can have this a lot. Basketball, you're jumping up and down, you can have this as well. That fascia then becomes inflamed at the calcaneal area, so the heel region. And then they have typically a lot of pain at that site, and then it usually gets better when they're not weight bearing, and that's just because they're not putting that on stretch. This says pain with dorsiflexion and toe extension. So what that means is if you were to ask the person to bring their foot up and then extend their toes, you're putting this whole piece of tissue on stretch. So if it's already inflamed and feels tight right there, it's just going to cause more pain. And so oftentimes this is caused by really tight calf muscles, which you maybe wouldn't think, but if the calf muscle is tight, so the calf is up here, you can't really picture it, but the calf muscle, if it's tight, it's going to put tension on your Achilles tendon. That Achilles tendon also has tissue that connects to your plantar fascia. So it's all a kinetic chain, which means it's all interconnected with movement. If this is tight, it's going to pull here. And then if this then gets pulled, it's going to be tight, and then it's going to pull down here. So that's why oftentimes I recommend if people have this condition to stretch their calves really well and also look into some type of arch support, because that's going to put a little bit pressure at this point in their foot, and then that's going to alleviate some of the tension. But as you get older, you're going to be more likely to develop this than somebody who is younger as well. And that's just having to do with movement. You can also have what is called hallux valgus. So this is a deformity in your great toe. And so what happens with this, we're going to go over valgus and varus more so when we get into the knee. But valgus means that your joint is basically getting pushed inwards. So, and I'll show you an image of this, but if you've ever seen someone with bunions, it looks like their foot is, or their toe is like at a very sharp angle. Somebody with hallux valgus essentially has this as well. And I wish I had an image for that. So I can demonstrate it in class on Monday, but just know hallux valgus is a condition that affects your great toe. You can also develop what is called turf toe. So what that is when you sprain the ligaments that are on the bottom side of your great toe or first metatarsal joint. And it's called turf toe because if you imagine, and this is common more so in football, especially with like offensive linemen or just people who are doing a blocking move, their foot is planted in that turf. And then they go to then push off. Well, sometimes when they're pushing off, they then overstretch this ligament, and then they can actually sprain it. So there are ways to treat it. There are ways to tape it so that it's no longer causing you pain. But again, this is just another common injury that affects your toe. You can also have what is called retrocalcaneal bursitis. So this is something I personally have not seen. It's more common, I would say, in older people, but it's called pump bump. And so if you remember when we went over the skeletal system and medical careers, you have bursa sacs. So they are fluid-filled sacs that are within all of your joints, and they're intended to basically cushion those joints so that the tendons and bones are not grinding on each other. Your Achilles tendon has a bursa. And so sometimes if there's so much rubbing, it can actually cause that bursa sac to become inflamed. And so it just looks like this huge little bump. It's called pump bump because women, and this is kind of, I guess, an old way of thinking because it's kind of sexist, but women wore high heels or pumps. And so the pumps, when they're walking, rub on the backside of their heel, and then they can develop this type of bump. So again, I personally haven't seen it, but it is something that can happen as well. Last thing we'll talk about are just the skeletal pathologies of the ankle. So you have your tibial and fibular fractures. So these are fractures obviously affecting your tibia and your fibula. They're typically caused by a direct blow, or sometimes they can even be caused by too much inversion or too much eversion. So too much basically rotation of the foot. And you will typically have that gross deformity. A lot of times it looks like the foot is like dislocated. So I think I mentioned, and you've seen images of these tibial fractures on some of these slides, but there was the Cowboys quarterback, Dak Prescott, I believe is his name. He actually suffered a tibial fibular fracture, so both of these bones were broken, and it just looked like his foot was like in a 90-degree angle. So if you're interested, you can look that up. But just know it's typically going to be allowed pop just because these bones are really big. And then they're going to have no ability to really bear weight because they broke those bones and you can't really stand on them if they're broken. They're going to have a lot of pain. They're going to have that crepitus because the bones are then, broken and grinding on each other. And then they're going to have a lot of swelling as well. And so if you look at these images, you will see this is a pretty clean break of the two. And obviously this is just an x-ray, but I can imagine that the bone is either close to the surface of the skin or it might actually be puncturing through. But sometimes they're not as obvious. You might not be able to detect it as well right here. But when it's broken like that, then yeah, you can definitely tell that there's a fracture. Typically with these fractures, there's going to be some type of surgery, and then depending on the severity of the fracture too, they might actually be putting rods or pins in. And so depending on the severity as well, these rods and pins might be in their body for a short period of time, or they might actually be in there permanently, or they might have these pins where they actually dissolve. So it just, again, is going to depend. You can also fracture your talus. So again, you can fracture any bone in your body, but just remember your talus sits under your tibia. And so when you break your talus, it's typically due to too much dorsiflexion, and then it says inversion. So basically your foot is brought back to too much, and then it's also like rolled inward with that inversion, and then you can fracture that bone. And so sometimes it can mimic an ankle sprain just because the mechanism is very similar to an ankle sprain, but just the pain is probably going to be way more severe. So if I think that somebody has a really bad ankle sprain, I typically will just refer them to get an x-ray just to be safe, because I'd rather err on the side of caution. And then if it comes back negative, then we can just address it from there. And then two, this fracture sometimes can develop avascular necrosis. So this isn't something we've talked about before, but necrosis means dying of tissue, and avascular means that there's not a blood supply. So this area is just a poor area of blood supply in your body. And so if you do have something going on, it can cause, it to take longer to heal, or the bone to actually start to have tissue death because you're not getting enough blood flow. And then this type of fracture sometimes we missed on x-rays. So they usually will need to use a CT scan or an MRI to confirm. And then again, depending on the severity, it might require a surgical fix. And the biggest reason why it requires a surgical fix is just because of the likelihood of the avascular necrosis to develop. You can also develop stress fractures. So just know a stress fracture is basically a fracture that's caused by chronic microtraumatic forces. What that means is chronic, you're doing a lot of repetitive motions. So stress fractures, again, are going to be common in a lot of things like cross country, running, because you're doing a lot of the same repetitive motions. And if you're running on surfaces that are really hard, they don't have a lot of forgiveness or give, then you're going to cause trauma to the joints and the bones. And with this, there's going to be a gradual onset. So what that means is it's not going to be something where it's like, oh, I just remembered it bothering me today. It's going to be like, okay, it hurt, 2 weeks ago. Okay, now it's still hurting. Month later, okay, it's getting worse. It's going to take some time. They will typically describe it as like an aching pain over the shaft of the bones. The shaft of your bone is the long part in between the ends. And then they will have pain increasing with activity. It'll obviously decrease with rest because they're not putting pressure on it. Sometimes they can be missed on x-rays just because the fractures can be so small. And then it can also mimic MTSS, which is medial tibial stress syndrome. So that's just the fancy medical way of diagnosing someone with shin splints. And so if you look at this x-ray, this is a healthy bone, or it might be just a different side of it, I think. But the stress fracture, I don't know if you can see, is right there. So it's relatively small looking compared to the other fractures we've looked at, but it's still a fracture nonetheless. Last thing we'll talk about, I believe, is medial tibial stress syndrome. So this is the medical way to say shin splints. So this is different than your stress fracture because MTSS can turn into stress fractures if it's not treated correctly. So mechanism of injury is very similar to the other one. It's just that basically if your calf muscles are tight or you're doing that constant repetitive motion of running and maybe you don't have proper footwear to support you, it's going to cause your calf muscles, so which would also be a part of your posterior tibialis muscle, to pull on the medial part of your tibia. And then that's just going to cause chronic pain. So your signs and symptoms, it's going to be gradual as well. They're going to have muscle fatigue. You might have your biomechanics changing. So maybe you're running with a different gait. There's going to be pain with activity. Same thing. It's going to feel relief with rest. They're going to have pain, diffuse pain. So it's going to be pain all along the inside of their tibia or shin. They're going to have pain at palpation. So you might say, point to the spot that hurts, and you might then press on it, and they might say, ah. And then they're going to have pain with resisted range of motion for inversion. So you're going to ask them, can you bring your foot inward? And then I usually will say, can you not let me push that foot now out? That resistance, when I'm resisting them, is going to be painful. And then this is just an example of where MTSS is located. So again, this is your fibula. So this is the lateral side of your foot. Inside, which is medial, this is going to be usually the location of pain for shin splints. All right, we will stop there for today. So just make sure you turn in your notes, and we'll talk about the rest at the next set of